Waiting too long to address back pain, we take it a few steps back. Having a good core and good muscle strength. That means the abdomen, and that also means the erector spinae muscles in the back. These are just so important as a preventative measure to prevent episodes of back pain. We don't actually have a ton of evidence to suggest that. That's actually just maybe more my opinion and what our general spine community thinks. So the more that anyone can do to support that core and support that low back strength is actually going to reduce any flare-ups of back pain. Ignoring back pain can be a mistake in that it's really important to work on that core strength and that lower back strength. And that is really one of the mistakes that a lot of people make in just ignoring their symptoms and not addressing treatment options that can help. One of the things that I see really frequently is sometimes patients come in with chronic pain or chronic back pain. We go over their imaging, and their imaging might not necessarily have a disc herniation, or it might not have any nerve pinching. And it can be really hard for patients to understand why they're experiencing pain when the images actually look okay. Well, I will tell you that's actually very, very common. And that comes to the root cause that we actually, as spine doctors and spine surgeons, we can't always see pain. We can only see pictures, and pictures only represent anatomy. So there are a lot of things that cause pain that we can't necessarily see on a picture. And so it doesn't mean that that pain isn't real. That pain is very real if the patient is experiencing it. But again, it doesn't mean that there's a disc herniation, or it doesn't mean that there's a nerve that's pinched. And so other things that can cause pain that we can't always see are the muscles. We see the muscles, but we don't necessarily see any anatomic abnormalities on the imaging. And that can actually be a substantial pain generator. We can see facet joints on imaging, but sometimes the facets might just have a little bit of arthritis, but they really are actually very irritating and a pain generator. So these are all examples of things that can cause pain, but that we might not necessarily see on a picture. There are lots of different interventions that patients can do at different stages of back pain. So if you're experiencing acute back pain, and that means you've been having pain for a day, 2 days, 3 days, the number one thing, and these are evidence-based guidelines from the American Academy of Family Practice Doctors, from the North American Spine Society, is stay active, keep moving, do not let pain get you down. And that is just so important in recovering from that acute episode of back pain. As that back pain continues longer, there are other types of interventions that we can do, but really importantly, we let symptoms be our guide. So what that means is if you're experiencing a lot of pain and you feel that your quality of life is diminished, well, that's when we can start talking about things like medications and things like injections, and further down the road, other types of interventions like surgery. If you've had severe back pain for days, weeks, months, and it's just not going away, well, it might be more than just a strain. Once again, I'm Dr. Deepti Jain. I'm a spine surgeon. And if you found any of this video helpful, hit subscribe to follow for more videos in the future.